There's an element, this is my first gathering for CCIH, and there is an element of family here. Is that true? So I think for this panel today, since there is an element and a feeling of family here, that we hopefully can make this, there'll be a presentation so we can get some information out, but let's have a conversation afterwards, right? And some back and forth and some questions. If we can keep it in that spirit, I think it's a late in the afternoon. You've had a lot of inputs today, so if we can make it most effective. As I thought about preparing to moderate this panel, I was thinking of the title, Voices from the U.S. Government, and various things came through my mind. One is, hi, we're from the federal government and we're here to help, and I didn't think that would go over particularly well. I'm here. And then I began to think biblically a little bit and wondered whether we were voices in the wilderness speaking out to you, or whether we would end up being maybe just a mini Tower of Babel of 4 or so people in front of you. But maybe we should begin by asking the Lord to give us all wisdom, like in Proverbs 9, that we can build ourselves a house of wisdom within this small gathering this afternoon and walk away both enriched and enlightened. Today's panelists will explain a bit about what each of our roles is, USAID, Department of State, and the Senate of the United States, a bit about how they connect with the faith world in that work, and explain what we do in that world. Is that acceptable to you all? Is that what you all signed up with when you walked in the door? Is that an amen, maybe? Amen. And amen, that's right. Terrific. So let me just go right into what I think is the pleasure and honor I get to do today, and I will read them out in order of how they will speak up and ask for them to introduce themselves. First, my colleague at the U.S. Agency for International Development, Dr. Abril Pablos Mendez, Assistant Administrator for Global Health. Then we'll have Shellie Bressler, Senior Professional Staff Member, Senate Foreign Relations, working with Senator Lugar, a terrific champion for these issues. And then Tom Walsh, Deputy U.S. Global AIDS Coordinator for External Affairs at the U.S. Department of State. So we have state, we have USAID, we have the Senate. That's a pretty powerful combination, I think, for you all. Thanks for being here, and turn it over first to Dr. Mendez.
Good afternoon, and thank you very much. I would like to thank Ray Martin also for the invitation to this gathering. It's a privilege for me. I am new to government, so I guess I still have perspectives from outside and inside, but I'm very happy and honored to be working for the U.S. government, for USAID in particular. USAID has just released its strategic framework for global health, which is really framed by both the principles of the Global Health Initiative and the reform efforts of Administrator Shah that we call USAID Forward, talent management, procurement reform, trying to get more local capacity, and so on. Many of you can take a look at that at any time. Our vision, I think we all share the vision. We want a world with healthy people, particularly women and children. And for that, we do a lot of the work with you, partnerships, technical leadership, and of course, increasingly working on evaluation and innovation and so on. USAID has been around for half a century, as you all know, and when President Kennedy launched it in the aftermath of World War II, we had a lot of recovery efforts, and together with Peace Corps, they were really joining the efforts of the faith-based community in rolling really a peaceful revolution in human progress and dignity. And I think it has been an incredible half a century across everything we do in government, in education, in health, in agriculture and nutrition, and so on. Our field used to be called tropical medicine. I used to lead global health at the Rockefeller Foundation. And in the first half of the century, it was indeed missionaries, and the science was the Rockefeller Foundation. There was no USAID, no World Bank, no NIH. And it was a successful era in its own way, science-based development working hand in hand with all of you in communities. With the end of European colonialism in the 60s, the field became international health, and it became more horizontal. It was more primary health care. It was a time of 50 or 60 new member states in the UN, in the World Health Assembly, and so on. The world had changed. With the end of the Cold War in the 90s, we changed again, and we became global health. Although the geopolitical changes marked these periods, AIDS became really the hallmark of this era as well. and with an implosion of hope in the continent, particularly in Africa. And again, all of you have been part of addressing that particular challenge and many other, but also there were many opportunities during this period, new philanthropy, new technologies, and really a revolution in global health led by the US government. The Great Recession is, I think, whether triggering or coinciding, but in any case, is associated with, I think, a big change in the space of global health. And I believe the way in which work is going to be changing. It's not so much that our budgets are tight, because we have been so far lucky, I think, for global health. The support of the people and the Congress has remained positive on balance. But it's that the fact that in many developing countries, after centuries of flat economic income, really, in the last couple of decades, there's been an incredible transformation. You have all witnessed it, but it's quite dramatically seen in these slides from 1600 to just recently, how in the last 30 or 40 years, growth has begun to take root. It's driven by better governance, by better education, by technology and trade, but also by what we call the economic dividend. That is, the success in our child survival efforts, the success in family planning, is driven a demographic transition that actually adds 1 or 2 percentage points to the GDP of nations for a couple of decades. So we are seeing that explosion in Latin America and Asia, now beginning in Africa, and I think it's going to be good news going forward, what we used to call the developing world. And luckily also there's a good relationship between GDP and total health expenditure. That is, as countries get richer, expenditure grows in a very, very direct manner. So that although for the richer countries it's a challenge to control expenditure, for the poorer countries means that there will be more and more resources locally to do by themselves, which is indeed what, again, when President Kennedy launched USAID, said the ultimate day when countries begin to do for themselves. And this is an example, India in the green dotted line. In the red line and the black line are two estimates of the basic package of health services, how much it costs to deliver basic health services. In the year 2000, India had $16 per capita in their economy when it took 38 or so to provide basic services. So India just didn't have the money in the country. There was just no money. So every assistance, every foreign assistance was paramount to save lives. But as India's GDP has been growing, their health expenditure has been growing, and is now just over the adjusted income, adjusted lines that we have there at $60 per capita, and projected to come to about 100 or so, 120 in the next couple of years. That is, India will have enough resources within the system. Doesn't mean the systems will be using the money to address the needs of the poor or do it efficiently, but it begins to open the door to a new era for how we do our work in these countries. And India is not alone. Many of the countries we are working are indeed crossing those lines. Of course, there are different countries who are not there, who will not be there, so there will be a staging and clearly a different approach for different countries. But the fact is that this is a transition that we are witnessing now that wasn't at play for the last 50 years of our work, and that represents very much the success of the development enterprise that the US, again, has been leading. It does call for change. Clearly how we engage developing countries. There's, on the one hand, the richer BRICS countries that are not only doing for themselves, really, but also beginning to join in development efforts in the regions and in Africa. And also many of them are beginning to cover their own needs increasingly. In many countries, we're seeing domestic expenditure growing. Oftentimes that expenditure is not well organized. It's out of pocket, half in Africa, 2/3 in Asia. And out-of-pocket expenditure is bad because even though people are having access now, they're going broke. Clearly, that cannot be the future of as we succeed in development and global health, that the financing arrangements for health are dysfunctional. So we see a greater need now to help countries organize their domestic financings so that as we begin to recede, those efforts can stay along. And organizing domestic financing towards the eventual goal on the aspiration of all nations to have access for all to appropriate health services at an affordable cost. And I think that there is great energy now behind that agenda. The second is that we need to evolve our own enterprise. And that's been changing indeed. PEPFAR 2 was already designed in a different way than the original PEPFAR. The Global Health Initiative was bringing principles of country ownership, sustainability, health system strengthening. All of that will be important. More integration and consolidation is going to be important as well. because our resources are going to be, although growing, being diluted really by both the growth of private flows into countries as well as the growth in domestic expenditure. And more importantly, I think it's a time to celebrate success. I see Shellie here, who will be talking shortly. But in the last decade, the efforts that the United States has put into this, and I wasn't in Washington then, so the credit goes to those who have been really pushing this line. It's been incredible. It's truly historical. And we also believe that not only should the American people be aware and celebrate this success, but also embrace bold challenges. And the challenges that we are envisioning have been already laid down as part of the top line of the Global Health Initiative. First, the beginning of the end of AIDS. An AIDS-free generation was already, the President and Secretary Clinton also have thrown down the gauntlet on the beginning of the end of AIDS. And now this sounds like a big, bold idea, and actually is beginning to happen. This is the blue line is the number of new HIV infections in South Asia, mostly driven by India. And the red line is deaths by AIDS. And as you can see, in the early 90s or so, the number of infections was growing. And all of that meant increasing number of people with AIDS. Since the late 1990s, around the world, and in this region in particular, the infection rate has been coming down. So for the last 15 years, HIV infection has been coming down. It's been coming down in Africa, most of African countries as well. And when these two lines cross, when you have fewer infections than deaths, the epidemics begin to shrink. So in Asia, that's already occurred. The epidemic is shrinking, and it will enter a self-accelerating phase. In Africa, it's not there yet, but it's predicted globally that this crossing of these two lines will occur in the next couple of years, and we enter a new era for AIDS. Clearly, the number of patients will not go away right away, but clearly it also means that the epidemic itself will be shrinking as opposed to growing as it has been so far around the world. Sorry. The second big goal that the Global Health Initiative has put forward is ending preventable child death. And forever, really, people thought that that child dying was part of almost life. It was inevitable. It was, even in Europe and North America, it was considered part of life. And you can see to any old cemetery in this country, and you will see that to be the case. But we didn't, of course, accept that. And last century, the infant mortality in Europe and North America just melted down, and it was quite dramatic. And this is before we had all the technologies we now enjoy. So all sort of changes in the landscape help do that. But going forward, this is also happening now around the world, thanks to the work that you all do, as you can see in this slide. The blue line at the bottom, from 1970 to today, is the rate of mortality under 5 years of age for OECD industrialized nations. The red is really for the rest of the world, the whole of the world. And in 1980, there were 17 million deaths. In 1990, about 12 million deaths. Today, we are about 7 million deaths. If the world was to have the same rates as the rich countries, OECD countries, that is less than 20 per thousand, then we will only have 2 million deaths in the world. The question is not whether we can achieve this, it's just when. And clearly, of course, that depends on how much effort we put into it. It is possible for this generation to end preventable child death and to bring that red line by 2035 within the range of OECD countries. This is indeed what is now the purpose of the call to action that we are having a big conference in Washington. Many of you are participating on that, to invite the world to join into what will be a civilizational accomplishment for our generation to end preventable child death. There are 5 countries that account for half of all children's death, just 5. I almost feel like polio, 5 countries, and they're not dissimilar. India, Nigeria, Pakistan, Ethiopia, and DRC Congo. We will need your help particularly with Ethiopia and DRC Congo. India, which accounts for 1/4 of all child deaths, is going to do it. India is going to calm down. It's already working. The rate of acceleration of India is relatively small compared to what they have already been doing. Ethiopia is also making dramatic progress, even Pakistan. But Nigeria and DRC are going to be really those places where we need all of the help we can get to make it happen.